As you begin your journey in occupational therapy, you will quickly encounter two fundamental concepts: activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. These terms form the very bedrock of how we understand a person's ability to function in their day-to-day world. ADLs are the essential self-care tasks we perform to manage our own bodies. Think of them as the things you do to get up and get your day started: bathing, dressing, eating, moving around your home. On the other hand, instrumental activities of daily living are a step up in complexity. These are the tasks required to live independently within a community. While ADLs are about caring for your own body, IADLs are about managing your life and your environment, managing finances, preparing meals, shopping for groceries, managing medications. So why is it crucial for you, as a future OT, to master these concepts and the tools used to measure them? These assessments are not academic exercises. They are diagnostic instruments for our profession. They provide objective data to create effective client-centered treatment plans. A thorough assessment reveals a client's starting point, strengths, and specific needs. That information lets you set realistic goals, design targeted interventions, and justify therapy to insurers and the care team. It is the first step in helping someone regain independence. Standardized tools also provide a common language for healthcare professionals. When you note a Katz Index score of 4, other clinicians immediately understand likely care needs. This consistency is vital when a client moves between settings: hospital, rehab, home. Learning to use these tools correctly, quickly, and confidently is a core competency. This essay will guide you through 3 common assessments: Katz, Lawton, KELS. Let's get started. The Katz Index of Independence in Activities of Daily Living is one of the most classic and widely used assessment tools in our field. Its primary purpose is to assess a person's ability to perform basic self-care tasks, the core ADLs we discussed. Developed by Dr. Sidney Katz in the 1960s, its enduring power lies in its simplicity and speed, making it useful in fast-paced settings like acute care hospitals or inpatient rehab. The assessment focuses on 6 fundamental ADLs. These 6 are the pillars of basic physical functioning: bathing, dressing, toileting, getting to and from the toilet and cleaning oneself, transferring, moving from bed to chair and back, continence, bladder and bowel control, feeding, bringing food from plate to mouth. Scoring is simple. Each activity equals independent, 1, or dependent, 0. Independent means performing the task without supervision, direction, or personal assistance. Using an assistive device like a cane does not make someone dependent. Dependent means any level of human help: verbal cueing, supervision for safety, or physical assistance. After scoring all 6, add the points. Total ranges from 0 to 6. For example, Mr. Jones, 82, recovering from pneumonia. Bathing, 0. Dressing, 0. Toileting, 0. Transferring, 1. Continence, 1. Feeding, 1. Total equals 3. While the Katz Index shows basic self-care, the Lawton Instrumental Activities of Daily Living Scale helps us understand more complex tasks for independent living in the community. Developed by M. Powell Lawton and Elaine Brody in 1969, this tool evaluates skills beyond personal care. It assesses a person's capacity to manage a household and function in society. This is crucial for discharge planning from hospitals or rehab facilities. It helps determine if someone can return home alone or needs support. The Lawton scale evaluates 8 key areas of function representing cognitive and organizational skills. Mrs. Garcia is 78, a widow who lives alone, and is being evaluated for home care services. On an 8-point scale, her total score is 3 out of 8. That score shows she has some capabilities but cannot live safely without regular support. So that's the Lawton picture in a nutshell. The Coleman Evaluation of Living Skills, or KELS, takes a broader and more performance-based approach to assessing a person's ability to live independently. Unlike the Katz and Lawton scales, which often rely on self-report or caregiver report, the KELS requires the client to actually perform or simulate a series of tasks. Its primary purpose is to determine a person's knowledge and performance of 17 basic living skills needed to live safely on their own. This makes it an excellent tool for making specific recommendations for living arrangements, such as independent living, group homes, or inpatient care. The KELS is organized into 5 distinct areas, covering a wide spectrum of life skills. Under money management, they are asked to identify coins and bills and to perform a practical task like writing a check or figuring out a tip. The Community Mobility and Telephone section assesses their knowledge of public transportation and their ability to use a phone to find a number and dial a number. Scoring the KELS is criterion referenced, meaning each of the 17 items is evaluated against a standard. For each item, the therapist scores the client as either independent or needs assistance. Needs assistance is marked if the client is unable to perform the task, performs it unsafely, or requires cues or help from the therapist. A final score of 5.5 or less in the needs assistance column suggests that the individual likely has the skills to live independently in the community. Choosing the right tool. A side-by-side comparison. Understanding when to use each tool is what elevates a student to a skilled clinician. The choice of assessment depends on the clinical question, the setting, and the specific needs of your client. Think of these tools as different types of lenses. Pick the right one to bring the client's functional status into sharp focus. The Katz Index is your go-to for a quick, fundamental assessment of basic personal care. Choose the Katz Index when you need a rapid baseline of body care ability, especially in an acute medical setting. Its focus is narrow, the 6 core ADLs. The Lawton IADL Scale is the logical next step when the question shifts to community independence. Use Lawton when planning a client's discharge. It asks, does this person have the cognitive and organizational skills to manage a household? The KELS offers the most comprehensive, hands-on evaluation of the 3. Choose KELS when you need a definitive recommendation about living situation. KELS is valuable when self-report may be unreliable. For example, cognitive impairment, psychiatric conditions, or poor insight. Where Lawton might ask if a client can manage money, KELS has them actually perform a financial task. That moves you from perceived ability to actual ability. KELS answers, can this person demonstrate skills needed to live safely and independently? And if not, what specific training do they need? Each assessment provides a different piece of the functional puzzle. Using the wrong tool can lead to an incomplete picture, missed opportunities for intervention, and potentially unsafe discharge plans. The true strength of the KELS is not just the total score, but the specific profile it creates, telling us exactly which skills to target in therapy, financial management training, and home safety education to ensure success. Knowing these differences is fundamental to providing ethical, effective, and client-centered care. This clarity will guide you to the right assessment every time. Pick the right lens to bring the client's functional status into sharp focus. Navigating the nuances. Common pitfalls and practical tips. Using these powerful tools effectively requires more than just memorizing the items. It requires clinical judgment. One of the most frequent pitfalls is relying solely on the client's self-report without verification. A client may overestimate their abilities due to pride, lack of insight into their deficits, or because they want to be discharged quickly. A practical tip is to always use a multi-pronged approach. If possible, observe the client performing a task. If you cannot directly observe, ask clarifying questions like, tell me the steps you take to pay your electricity bill, or show me how you would call for help in an emergency. Corroborating information with family or caregivers is also essential. Another common error is applying the scoring criteria inconsistently or incorrectly. For the Katz Index, a key tip is to remember that independence includes the use of assistive devices. A person who can transfer safely with a walker is still scored as independent. The dependent score is triggered by the need for another person. For the Lawton scale, a critical tip is to be aware of which version you are using and its specific scoring rules. Also, be mindful of pre-morbid roles. If a husband never handled the finances in his life, his inability to do so now may not reflect a new deficit. Your assessment should focus on whether he could learn or direct the task if needed, not just whether he has done it historically. With the KELS, a common pitfall is rushing through the performance-based items or providing too many cues. The goal is to see what the client can do on their own. A practical tip is to set up the testing environment ahead of time with all the necessary props: phone, mock bill, play money. Also, pay close attention to safety-related items. Always document not just the score, but also your qualitative observations about the client's performance, frustration level, problem-solving approach, fatigue. Finally, a universal tip for all three assessments is to avoid mixing and matching items. Each tool was designed and validated with a specific set of items. Adding or changing them compromises the integrity of the assessment. For exams, make sure you have memorized the specific items for each test. A common exam mistake is to confuse the 6 items of the Katz Index with the 8 items of the Lawton Scale. Use mnemonics or flashcards to keep them straight. For example, for Katz, you could use BATted, bathing, toileting, transferring, eating, dressing, continence, your roadmap to mastery. In the world of occupational therapy, the Katz Index, Lawton IADL Scale, and KELS are more than just forms to be filled out. They are foundational instruments that translate human function into a language we can use to heal, support, and empower. Mastering these tools is a critical step in your development as a competent and confident practitioner. Your roadmap to mastery is simple. Learn the items, practice the scoring, and understand the purpose. Use case studies to challenge yourself. Ask, which tool would I use here and why? By internalizing the function of each assessment, you will be well prepared for your exams and, more importantly, for the real-world challenges and rewards of being an occupational therapist. You will have the skills to accurately assess your clients' needs, celebrate their strengths, and guide them on their path back to meaningful, independent living. This is the core of what we do, and it all begins with a solid assessment.